Today we are unveiling the Alberta Substance Use Surveillance System, an important new online dashboard for substance use data that will help us support addictions recovery. This new online reporting tool, which you can see on the screen beside me, will replace the previous quarterly reports and expand on the data that we report. Now, since opioid poisoning rose to prominence as a major public health crisis around 2016, the harms of other substances have received less profile and less attention. Similarly, when we talk only about opioid-related harms, we perhaps unintentionally neglect other forms of addiction and the harms that they can cause. All addiction, no matter the substance, can tear families apart, destroy livelihoods, ruin lives, and strike at the very heart of our communities. That is why, in addition to data supplied in previous reports, Alberta's substance use surveillance system will expand to include other substances like alcohol, methamphetamine, and other drugs. It will evolve over time to include more comprehensive information regarding the impact of addiction. The online system has several advantages over the previous reporting format that will also better support service providers, program operators, and community leaders in addressing the addiction challenges that we're facing in Alberta. While other jurisdictions like Ontario, BC, and Quebec also publish similar data, the Alberta Substance Use Surveillance System will be by far the most comprehensive in Canada. It features dynamic and interactive data set displays in which users can view information by city, zone, or province-wide, broken down by substance and in many different display options. It provides ongoing and timely updates to validated data, and it is structured to quickly add new data points and reporting metrics as they emerge. To begin, we'll look at the acute substance deaths overview as an example of the data available in this system. So as you can see here, when we look at acute substance fatalities, this data can be broken down by substance, by zone and municipality, and it provides more detailed information about each month rather than the quarterly totals that was available in the previous reports. This data is further broken down in other tabs with zone comparisons and demographics. This slide shows all opioid-related fatalities, which, as I mentioned before, peaked back in July before declining by a third in October, 2 months ago. While there could be several factors impacting this decline in fatalities, one that I can point to is the distribution of Naloxone. As I mentioned earlier, we continue to focus on proven interventions like the widespread distribution of Naloxone, demonstrated by record numbers in the third quarter of 2020. This data in the new system includes self-reported overdose reversals, the number of kits distributed differentiated by community kits and pharmacies, and a breakdown of zone and registered distribution sites. This provides valuable information about whether further interventions may be necessary. When looking at recovery options, the AHS opioid dependency program patient count, as shown here, it shows us the patient counts over the past 2 years. These programs provide Albertans with evidence-based first-line and second-line medical interventions for opioid addiction. So as you can see, public health measures in the spring did cause patient counts to drop from nearly 900 in January to only 56 in April, a 94% decrease, and there is no doubt that that had a very damaging impact, which we regret. While these clinics have returned to normal operations, they remain below half of their pandemic patient count. This demonstrates an extremely concerning lack of access to treatment during the pandemic. We're working hard to track usage and capacity of the residential treatment centers, as many of them have had to cut their capacity in half during the initial stages of the pandemic and are still recovering because at that time they developed long wait lists. Lastly, I'd like to show one last image in this new system. The impact of addiction goes far beyond the effects of opioid overdose. Here you can see emergency department visits and hospital admission related to alcohol alone. In the third quarter of 2020, we saw 11,500 admissions to hospital due to alcohol use. During the same period, we saw 2,940 admissions due to opioids. That's interesting. This is not in any way to diminish the impact of opioids, but simply to illustrate that the effects of addiction extend far beyond opioids, and the need to look at the full picture of how addiction is impacting our population. With better data collection, the government can make more informed, strategic policy choices about how best to support Albertans seeking recovery. Evidence-based decision-making will ensure that we are providing services when and where they will have the biggest impact. This is one of the many ways we've led the country on comprehensive data and mental health and addiction care.